First to our top story today, 22 kidney patients at the Singapore General Hospital have been diagnosed with hepatitis C virus infection. 4 of these patients from the renal ward have died. The hospital said they were also suffering from other conditions and the hepatitis C virus infection may have been a contributing factor. Now, these patients were admitted between April and June this year. Initial investigations show that the use of multi-dose vials may have been involved in the transmission. Now, these vials contain more than 1 dose of medication required for an injection.
Hepatitis C, which causes liver cancer, is transmitted mainly by contact with blood of an infected person. Other ways of transmitting include unsafe injection practices and inadequate sterilization of medical equipment. While the hospital has yet to determine the cause of the infections, its preliminary investigations show that it could be due to the use of multi-dose vials.
In multi-dose like insulin, and there are a number of multi-dose vials currently. Insulin vaccines are one of them. These are generally shared, and so you use it for that person using a new syringe and a new needle, but it is then shared across multiple patients. Because the idea is that you would have swapped the bunk, you would use a new syringe and new needle for that episode. There's no reason. And there's no reason for it to be contaminated again. So if in theory that this is the cause of it at the end of the day, then there may have been some contamination along that process.
On April 17, the first case of the hepatitis C infection was being diagnosed. 4 other hepatitis C cases were subsequently diagnosed, and on 14th May, internal investigations of the dialysis centre were being carried out. After the dialysis centre was being cleared as a potential source, the infection control team intervened on 2nd June. On June 10th, the use of multi-dose vials was stopped in the renal ward, and when it was established that the use of multi-dose vials may have been involved in the transmission, the use of multi-dose vials was stopped hospital-wide on June 24th. At a news conference on Tuesday, the hospital explained why it took a while to determine the specific cluster.
If you look at the first few cases, it doesn't ring a bell until there's a pattern. Thereafter, then we inform Ministry of Health that we have a cluster, and we brought in experts from our hospital, so at least we have independent verification that these are issues.
Of the 22 patients, 19 had transplants and nearly half had recent high-dose immunosuppression therapy to prevent organ rejection. Meanwhile, the Health Ministry has convened an independent review committee to provide an objective review of the hospital's findings.
Let me apologize on behalf of the hospital for the patients as well as their family members. My thoughts are with them. Our priority is now to ensure that the patients are taken care of. The Ministry of Health is also taking the incident very seriously, and that is why I have decided to appoint an independent review committee to ensure an objective and thorough review of the incident so that we can also identify gaps or possible weakness in our infection control system, as well as to recommend additional safeguards, if necessary, that can be introduced.
The hospital is in the process of reaching out to over 400 patients who passed through the affected ward from January to June to get them screened for the virus.
Now, hepatitis C is a slow, progressive disease that takes years to damage the liver. But a liver disease expert says there are rare cases where hep C could lead to death within weeks. Leong Wai Kit with the report.
Hepatitis C is a disease that damages the liver. Antiviral medicines can cure about 90% of those with hepatitis C infection.
Even the immunosuppressed people like organ transplant recipient or people on dialysis, it takes about 10-20 years to have very bad liver damage. The only exception is an organ transplant recipient, whereby they are on immunosuppression, so the immune system is down, and the hepatitis C may progress very rapidly. That's a very rare syndrome. We call it fibrosing cholestatic hepatitis C. I've seen before, but they're very, very rare. In those patients with fibrosing cholestatic hepatitis C, they can die within 2 to 4 weeks, but that's very, very rare.
While it is a blood-borne virus, the doctor said people are not likely to get hepatitis C through a blood transmission, as Singapore started screening blood donors for hepatitis C from 1995.
They asked a whole list of questions. They will screen out any risk factor for hepatitis C, hepatitis B, HIV, etc. The blood bank would then test them for hepatitis C test, and they were very, very accurate. So the chance of someone getting hepatitis C from a blood transfusion in Singapore is almost zero, I would say.
Dr. Y added that those with hepatitis A get it through contaminated food, and they almost always recover without long-term problems. But Hep C is more serious and can lead to chronic liver problems. For now, there is no vaccine against hepatitis C.
Well, the National Kidney Foundation has nearly 3,000 dialysis patients at its centre. Referring to the outbreak at SGH, it says it has strict procedures to ensure patient safety, which include not using multi-dose vials. In other words, nurses do not inject patients by attaching new needles and syringes to a shared vial of fluid.
These dialysis machines are cleansed after each use. A solution is used to remove impurities, a process that takes up to 20 minutes. Each patient also has his or her own dialyzer, a device which acts as a kidney. These can be reused for 1 month. For patients with hepatitis C, the device is used only once as a precaution. And if a patient is found to develop any ailments such as fever during dialysis,
we stop the dialysis procedure immediately, and then the machine would be embargoed. We will not use the machine until further tests are done on the machine.
nurses are trained to observe these safety protocols.
We have a very rigorous training plan for our nurses, whereby we teach them infection control protocols and other renal management procedures. We also run regular audits, and these audit findings are shared with the staff. And should there be gaps, we have our staff who will come in to immediately plug the gaps and ensure that standards of practice are maintained.
Nurses are also reminded to never reuse needles.